Good morning, everyone, and welcome to the webinar. My name is Saili Willis, and I am the Community Advocacy Associate at California Pan-Ethnic Health Network, aka CPEHN. I'm joined by my colleague, Carolina Valle, who is the Policy Manager who has really led this research and report. Today, we will be talking about the findings from CPEHN's new report called Accessing Mental Health in the Shadows, and basically talks about how immigrants in California struggle to get needed care. So we have a jam-packed webinar that includes an overview of the report, the background of why CPEHN did this research, and we will talk about the research methods that we used. And then we have a guest speaker, Natalie Santamaria from Visión y Compromiso, who will share the impact of our current political climate on the mental health of immigrants and undocumented immigrants. And Natalie will be providing information from an on-the-ground perspective. And then we will also be going into the findings from the research and really talk about recommendations on how to improve mental health access for immigrants and undocumented immigrants. So before we dive in, I'd like to give an overview of who CPEHN is and the reason we did this research. So CPEHN is a statewide multicultural health advocacy organization that works to ensure all Californians have access to quality health care and can live healthy lives. We gather the strength of communities of color to really build a united and powerful voice for health equity. CPEHN has a long history of working with local and state mental health advocates on health and mental health policies. And so we convened a statewide collaborative called the Behavioral Health Equity Collaborative, also known as BHEC, comprised of local and state advocates. And the mission of this collaborative is to really pursue greater investments into appropriate and quality mental health services for communities of color and other historically underserved communities. So why did we do this research? We know that we're living in a political climate of hate and bigotry, and this has a harmful impact on individuals and families, not just on their health, but also on their mental health. With that being said, in 2017, we gathered our BHEC partners together, and they really wanted to know if immigrants are receiving mental health services regardless of medical eligibility. And so CPEHN did this research to really answer that question. And so our research really included interviewing 15 county behavioral health leaders from 12 different counties in California, which you can identify on the map as the green dots. And then the yellow dots on this map indicates the 12 stakeholders we interviewed, which includes nonprofit mental health providers, legal aid organizations, community-based organizations, and other health care entities. And the orange dot on this map shows the 4 different listening session locations CPEHN hosted to gather local advocates together to discuss regional policy issues, including the state of mental health in immigrant communities. So we gathered these folks together to really get to answering this question around are immigrants and undocumented immigrants receiving mental health services, regardless of medical eligibility. So now that I've described who CPEHN is and who BHEC is and the reason we did this research and why it matters, I'm going to turn it over to our partner, Natalie Santamaria from Visión y Compromiso. Natalie is the Kern County Promotora Network Manager and is going to talk about her experience working directly with immigrant families in Kern County.
Thank you very much. So what I'm going to be touching is how the immigrant experience impacts mental health and wellness. And I am going to be talking about our experience as a community-based organization working with promotoras on the ground. Next slide. So when a person migrates, it is not only an issue of having legal status or not. It is much broader than that. Immigrants are often faced with challenges such as adapting to the culture, the language, the environment, many times having to leave family behind. And in many cases, it includes leaving their children behind. And all of these are examples or stressors. So when we talk about immigrants, we need to be aware that when those stressors do become severe, they are faced with the Ulysses syndrome, which Ulysses syndrome is a series of symptoms experienced by migrants facing chronic and multiple stressors. So when all of those stressors I just mentioned and some, become chronic, then they're faced with Ulysses syndrome. Now, it's important to know that Ulysses syndrome is not a mental disorder, but it is immersed in the mental health scope. Therefore, the identification and reduction of complication of symptoms associated with the Ulysses syndrome pertains entirely to the areas of prevention and psychosocial well-being and not the curative one, which means it's more, again, of an adapting to the place you're in, becoming familiar with it, that is going to help reduce those stressors. Next slide, please. So again, we're talking about the mental health of our immigrant community, and we need to include the words uncertainty, stress, and fear. As previously mentioned, being an immigrant in this current political climate, it's bringing a lot of these three stressors to our communities. They're uncertain of what's going to happen. They fear when they go out to work or their day-to-day activities. They fear if they're going to be able to come back to their home or not. And that causes more stress to them. Many of them, we have heard here in Kern County, have stopped going to the grocery store. Many of them have stopped taking their kids to school, and many of them have also stopped working. And they have really just secluded themselves because of everything that is now going on. So if on top of that we add the limited access that this community has to mental health, it is really a concern to our communities because now we're not only seeing it on adults, but we're also seeing children being affected by this. And many of these children do have documentation, they're citizens, but they're still being affected and still have lack of access to mental health services. And it can be one because parents fear taking them, and many of them have even disenrolled them from Medi-Cal, or two, because they don't know that these services are available. Next slide, please. So as Sally mentioned, I work with Promotoras, the organization with Visión y Compromiso. And here in Kern County, what we did last year is we developed a series of 7 workshops that talked about the mental health of different communities. And this was in collaboration with Dignity Health and the Community Health Initiative of Kern County. So these 7 workshops, and it all started with the idea of just making one forum. And what we wanted to do was be able to understand and explain the process of accessing mental health. This is how it all began. But in the planning and talking to those agencies that would be able to come and present, we were faced that, many of us were not even able to figure out what the process was, nor promotoras knew what the process was. And it was very frustrating because promotoras are bridges, they're liaisons between the community and resources. So that was their goal. They wanted to know, how can I help my community access mental health? When I see somebody that is going through a challenge that needs help, how am I going to guide them and go with them along this journey of accessing mental health? But it was very frustrating to find that We at the, at the front line of those resources, were not able to get many of those answered. So, we had the forum. We did have our local mental health department present, but again, there's something missing there to where it's so clear to the promotoras and community on how to access them and whether someone who is documented or not can access services and to what extent. So again, from that very first uh, workshop that we had, where we had almost 100 people in attendance, the other six came along and they each focused on different communities. One of them was on the mental health of the immigrant community. In that particular workshop, we had Know Your Rights, role plays. We were able to explain to people how to create a plan in case anything happens. And we gave them a lot of more resources of agencies that can help them. We have a rapid response network here in Kern County as well, and we were able to talk about that. And again, there were other communities or areas that we focused on those seven workshops that we did. But our goal was to know and understand the process that the local county health department has. And we were not able to, and found that frustrating, um, to be able to relay that to our community. So we are still working towards that. I was able to establish a relationship with the mental health department, and we are hopeful that, in the coming years we will continue to develop and strengthen that relationship among promotores and the health department so that we can, build that bridge between community and these services. Again, we have seen the impact on not only adults, but the children in accessing these services. Next slide. So these were our findings, working right at the community-based level. Again, we will continue to work. There are other areas this year that the Promotoras Committee are working on. We do have a workshop on the mental health of men. We found that, they are the head of household, and many times they don't receive those services, especially in the Hispanic community. There's a lot of taboo. If you would like to engage or just know more about it, there's my contact info. We can connect, and thank you very much.
Great. Thank you so much, Natalie. Hi, everybody. This is Carolina Valle, and I'm with CPEHN. Thank you, Natalie. Thank you, Sayuli, for those great introductions. I think it's very clear that we have a long way to go in this work, working with counties, with community-based organizations, and other advocates that want to improve access to mental health care for immigrants and undocumented immigrants. So I'm going to actually now talk a little bit about some of our findings that are really based on the foundation that Sayuli and Natalie provided. But before we dive into the findings, I'd like to take a poll of the people who are on this call. And I'd like you to answer this question. Do you know if people ineligible for Medi-Cal due to immigration status can access county mental health services? Can they access county mental health services even if they don't have Medi-Cal? And I'll wait a minute for people to think about it and answer. Great. I see. Okay. So we're looking here, and it looks like almost 50% of people think that yes, folks ineligible for Medi-Cal due to immigration status can access county mental health services. So that's really great, and we'll come back to that poll at the end. All right, next slide. Okay, so I really want to start here with an overview of the specific counties, community-based organizations, and listening sessions. These are all of the entities that we interviewed for this research. So you can, for folks that are working on the local level, I really would like to bring your attention to the left column so that you can see which county behavioral health departments we interviewed for this report. And if folks are interested in connecting with county folks in these areas, please do reach out, because we would want to support your relationship building and a lot of the work that Natalie has already undertaken in Kern County. But I put this up here because what we found as a broad finding of this research is that counties, community-based organizations, and providers do share a concern for the mental health and well-being of immigrant communities. And they also recognize that there's a really enormous need to improve access to care. So since the election, since the presidential election, there's just been such a huge impact on immigrant communities, but partners have really struggled to keep up with how to meet the need. We know that California has introduced some of the nation's most progressive mental health policies, especially for underserved populations. In fact, today, most low-income Californians are eligible for mental health services through a variety of options. And so even though there have been enormous strides in health coverage, low-income undocumented adults specifically still comprise the majority of those without access to full-scope Medi-Cal and their mental health benefits. So our evaluation found that, yes, California's public mental health services is struggling, and large segments of immigrant communities, especially undocumented communities, are going without mental health care. And so in light of that context, we interviewed psychologists, social workers, MFTs, folks that are working in the county system. And this entire field of public mental health services play a really important role in the mental health and well-being of immigrants and undocumented immigrants. They have training in trauma-informed care, they follow important ethical and moral codes that guide their work, and they care deeply about the safety and well-being of their clients. That's what makes public mental health services so effectively positioned to be allies in this work. And so as you can see in this graph, we interviewed a wide range of stakeholders from across the state, and all of them shared that they are dealing with this extraordinary dilemma. How do you serve a population that is living in deep fear of their safety? How do you properly measure access to care among a population that is at risk of exposure and deportation? Indeed, this is an extraordinary dilemma. But to properly determine their access to care, we must first follow the money and evaluate funding. Next slide. So we interviewed 15 county behavioral health leaders from 12 different county behavioral health departments. We've already established that stakeholders are committed and willing to improve access to care. But what about funding? Are there funding sources outside of Medi-Cal that can help pay for the cost of mental health care for undocumented immigrants? For example, can the Mental Health Services Act pay for the mental health care of undocumented immigrants? And what we found is that yes, the Mental Health Services Act is a big opportunity to serve the mental health and well-being of undocumented immigrants. Next slide. So this is just a little overview of the Mental Health Services Act, which was actually a ballot initiative passed in 2004. And the reason I highlight that it's a ballot initiative is because it actually shows that voters were invested and recognized the importance of expanding our funding for mental health care. And so you can see here up the top that the Mental Health Services Act continues to generate a really enormous source of revenue from mental health care. It's actually second to Medi-Cal, the biggest funding source for mental health care in our system. You can also see here that the overwhelming majority of 95% of the mental health services revenue actually goes directly to different service components, including community services and supports. Community services and supports is more intensive services for people with a higher level of need. It's for people that might have more complex needs, who might need more case management services. And then you can see number 2 here on the right, prevention and early intervention. And that 20% of those funds go towards counties to provide support to those communities that might be showing their first signs of mental illness, or who might need some support because of external stressors in their lives and normal development that can put pressure and stress on people. And then you can see going down that there's an innovations component. And innovations is about 5% of the MHSA funds, and that really goes towards kind of what it says, innovation. So it actually gives counties the opportunity to try new practices that might not have the evidence of, say, community services and supports or prevention and early intervention. And so this is really important to know about the Mental Health Services Act when you're thinking about immigrant communities, because what you see through this graph is that it actually provides the full spectrum of care, and that there is the backing of the law to provide that care to immigrants. Next slide. So just coming back to this graph, it's a little bit confusing. It's a question that we asked the 15 county behavioral health leaders. And what we asked them point blank is, outside of Medi-Cal, do you believe there are any restrictions on funding that prevent you from providing mental health services to undocumented adults? And what we found was that the overwhelming majority of county stakeholders said no, they do not believe there are any restrictions on funding sources outside of Medi-Cal, such as the Mental Health Services Act, that would prevent them from providing care to undocumented immigrants. Next slide. So just another picture here of the Mental Health Services Act. You can see that the MHSA represents, here in the yellow, a very large slice of the pie. So what I would say to all of the advocates on the line is that there's no reason why undocumented immigrants should be legally restricted from being able to access county mental health services, because there's no restrictions on MHSA that would prevent them from doing so. Next slide. So we know that doesn't tell the full story. Natalie talked about the overwhelming challenges of connecting clients to the county mental health system, challenges and barriers in the referral process. And so when we did our research, we found that counties and CBOs and providers shared a number of additional barriers that prevented them from really understanding their rights and responsibilities in serving undocumented immigrants. Many of them noted here in the top left corner that state oversight agencies such as the Department of Healthcare Services, when they talk about mental health care and when they talk about beneficiaries and when they talk about people who can access care, they often refer to them as Medi-Cal beneficiaries. And this is problematic because we already know that the Mental Health Services Act, in addition to Medi-Cal, can support the mental health and well-being of undocumented immigrants. And so it's not, when DHCS says in their policies that mental health care is for Medi-Cal beneficiaries, it doesn't actually capture the mental health of those that are ineligible for Medi-Cal. Looking here in the top right-hand corner, you see interpret responsibility difference. So this is really important because many of us are local advocates, and so we need to understand how our specific counties are providing and interpreting their responsibility to serve undocumented immigrants. And what we found was that counties interpreted their responsibilities differently. And a really good example of this is when we're talking about level of need or severity of need. And so when we talk to stakeholders, some stakeholders were really clear on their responsibility to serve those immigrants that have the most severe needs. So people that might have a diagnosis, or people who might have multiple hospitalizations, or people who may have a history of substance use or homelessness. They were really clear that it was their charge to serve this population. And we talked to other counties who were really clear about a different responsibility, who were really clear about their responsibility to serve those immigrants that only needed preventative care, those that might be experiencing signs of depression or anxiety for the very first time, those who might have some types of social support in their life, but were going through some temporary life stressors. And so what the big picture takeaway on this is that counties are interpreting their responsibilities differently. Some are interpreting their responsibility to serve undocumented immigrants in only the most severe conditions or circumstances, while others are doing the opposite. Some are interpreting their responsibility to serve this population on the more preventative scale. So really important to talk with your individual communities about what's happening and what people understand their rights and responsibilities as. So going down to the left box here, left bottom box, is lack of capacity. So this is probably not a surprise to any of the advocates on the call that our county mental health system definitely has some room for growth when we talk about capacity. Many undocumented immigrants might speak a second language, and so there might not be enough providers who can actually provide the culturally and linguistically appropriate care. But I think another big important piece, and something that Natalie highlighted in her presentation, is that when we talk about the experience of undocumented immigrants, it's not only a legal question that we're talking about, but it's also a question of how this is impacting people's safety, well-being, and their mental health. And so our system of care really needs to build their internal capacity to understand that experience. So it's not only about language, but it's also about what the impact is of being undocumented on people's mental health, and does our mental health system have the capacity to meet that need? So looking at the next corner here is data collection. So data collection is a really big concern for county mental health departments. They do follow, as I mentioned earlier, very important ethical and privacy codes. That is something that is part of their training already. So that is something that counties already do and is a really important value for them. But what I'm saying about data collection and what we found through this research is that when we talk about our county mental health system, we want to make data-informed choices. So we want to know what the population actually looks like in our community, right? Our county behavioral health system is a locally controlled and administered program. And so it's really the responsibility of counties and in the interest of counties to understand what the makeup of the undocumented population looks like and have an estimation. But they don't know how to do this. They don't have the tools. And there's a really important and legitimate concern about what the risks are associated with data collection in this community. And so again, they are really struggling with this dilemma of how do we properly serve a population when we don't want to put their safety at risk by collecting data. Next slide. So, taking a step back and assessing the advocacy efforts of counties. We know that there are no restrictions on funding when we're talking about MHSA. we know that there's a willingness to improve access to care. And so we wanted to know, sort of on the systems level, are counties actually talking about this issue? Are they engaging with their partners in their communities to talk about the mental health needs of immigrants and immigrant communities? And so if you look here on the graph on the right, the big green part of this pie, we asked counties, are you engaging with other entities, including the Board of Supervisors and the District Attorney's Office, on the mental health needs, about the mental health needs of immigrant communities and the strategies to provide these in your community? And what we found is that, yes, counties are talking with other county entities. They are talking with their Board of Supervisors. They are talking with their District Attorney's Office. And so that's really important to know when we think about windows of opportunity and where to engage. But if you look here on the left graph, on the left pie chart, we also asked CBOs this exact same question. We asked them if they know whether their county is engaging with other county entities. And what we found was the inverse. The majority of CBOs don't know whether their counties are engaging with other county entities. So what that tells us is that there's a really big gap in the engagement of community-based organizations on the issue and discussions of the mental health needs of immigrant communities. So a really important flag for people on the call when we think about how we can engage on the local level to really advocate for this community. Next slide. Great, so let's see, assessing the needs, okay. So the last area that we evaluated was whether counties have considered doing a formal needs assessment of the mental health needs of immigrants and immigrant families. So taking a step back here, counties and mental health professionals do individual assessments. So when they meet with a client, they are doing maybe a biopsychosocial assessment to understand the history of that specific client, some of the experiences that they've had. They're doing an assessment to understand where they're at. And this question is not about whether they are doing individual assessments, because that is already a core part of mental health work. This question is asking whether the community as a whole is doing a population level assessment. Are they gathering their resources to do a survey, for example, across the community to understand what the needs are? And so we asked them, do you even see a value in doing this? Is this something that you would want to do in your community? Do you want to do a formal needs assessment? Would this be useful given the climate that we're currently in and all of the changes that have happened? And what we found was that stakeholders are really interested in doing this. They see a value in doing a formal needs assessment. So 9 out of the 12 counties that we interviewed said, yes, we see a value in doing a formal needs assessment. So again, when we're thinking about opportunities to engage and issues to advocate for, this is a really important one. Next slide. So I've already talked about this sort of through the other slides, but just to kind of bring it home, when we, again, Natalie talked about this earlier, when we talk about what it means to be an immigrant and what it means to be undocumented, we're not only talking about this as a legal question, we're also talking about this through a more holistic perspective. And county behavioral health departments are really struggling. They're lacking some of the tools, training, and capacity to conduct the culturally and linguistically appropriate assessment of the mental health needs of immigrants, but especially undocumented immigrants, because because of all the challenges that we noted earlier, it's really been a big barrier for them to understand what the mental health needs of this unique population are. Next slide. I'm going to pass it over to my colleague Saili now, who's going to continue to share a couple more of our findings.
Thank you, Carolina, for providing an in-depth look at mental health funding for immigrants and undocumented immigrants and the importance of formal needs assessments and cultural and linguistic competency to really understand the needs of this population. So now let's get into what safe space policies is. So in 2017, the California Values Act was passed, which ensures that state or local resources, such as schools, courthouses, hospitals, offer physical, legal, emotional protections for undocumented immigrants who are fearful of accessing services in public spaces. So during our interviews, we asked counties if they have implemented safe space policies in their county mental health facilities, and 8 out of 12 of them said that they do not. And so our stakeholders, our county behavioral health departments said that they follow important ethical codes and patient privacy laws. However, many of them indicated that they have never received trainings to prepare for an encounter with ICE or CBP. Stakeholders also expressed the desire to get the correct information and training to support their clients. The state and a number of counties have taken steps to protect immigrants from detention at public health facilities, but implementation is still unclear. So now that you have heard our findings, I'm going to lead you all into recommendations on how we can address the challenges that came up. These recommendations come out of discussions with our stakeholders, including our partners from the Behavioral Health Equity Collaborative, county behavioral health departments, community-based organizations, and others. So first and foremost, we want to expand Medi-Cal for low-income undocumented adults because mental health is a carved-out benefit. It will codify undocumented immigrants' right to mental health care if they're able to access mental health benefits. And MHSA is not a benefit, so we really think it's important that we really pursue the opportunities that make it a benefit for people. So currently, Medi-Cal provides coverage for all use regardless of immigration status. Earlier this year, Governor Newsom prioritized in the state budget to expand Medi-Cal eligibility to adults up to age 26, regardless of immigration status. However, the goal is to ask legislators to pass SB 29 and AB 4 to expand to all adults, regardless of immigration status and age. So now we're going to go into best practices on safe spaces. So in our findings, we talked about safe spaces and the importance of these to really make undocumented immigrant patients feel safe to get the care that they need and want. And San Bernardino County is an example of how they promote safety and access to mental health care by hosting public stakeholder meetings to really have discussions about mental health policies and what they want that to look like in their county. With that being said, we recommend that the state issue and monitor safe space policies to state, county mental health facilities and private nonprofit mental health organizations. What this could look like is providing them with preparation on encounters with ICE or CBP and providing personnel trainings and front desk protocols, patient privacy and protections, patient materials and messaging. And we also recommend that county behavioral health departments partner with community-based organizations and legal aid organizations to develop these sample messaging that communicates safe space policies to all stakeholders, including county mental health facilities, private nonprofit mental health organizations, and the clients themselves. So, to really understand and know the needs of immigrants and undocumented immigrants, we recommend that the county behavioral health departments do formal needs assessments of mental health needs of this population. Remember, as Carolina said in a previous slide, counties really find value in informal needs assessment. And also for county behavioral health departments to have discussions on how to safely collect data and reach out to undocumented immigrants without exposing their identity. We recommend that the state provide greater direction on metrics counties can safely use to evaluate mental health disparities among all immigrant communities, including undocumented immigrants. So I am going to pass it back to Carolina to talk about other statewide opportunities, and then we will start our questions.
Great. Thank you, Saili. So as Saili mentioned, we urge counties to do formal needs assessments of the mental health needs of immigrants and immigrant communities. And so wanted to flag for all the advocates on the call that one statewide opportunity to do this is through the Cultural Competence Plan. So just a little bit of background. Every county behavioral health department is required to do a cultural competence plan. And what we found through our research is that this is really an important space for counties and community-based organizations and providers to come together and address disparities. And so we think that this tool can be further maximized and to further support the great work that counties have undertaken already to try and improve their areas of growth. And so we are co-sponsoring this piece of statewide legislation that would really require counties to further build out their cultural competence plans by, for example, having them report additional data on immigrants in a safe way without exposing individual identity, more data on language access and disparities in utilization. And so because counties have really recognized and are wanting to engage and improve access to care, we also think that the state needs to do their part too. We know that immigrants make up a huge part of California, and so this is really a statewide issue, and we want the department to specifically look at these plans and provide the technical assistance on these very complicated issues that counties need to do. And so we want to continue to build their capacity by requiring that they also set performance targets. So what I mean by performance targets is that it's not just enough to collect and report data on the populations and communities that are in your county. It's also really important that we actually make progress and demonstrate that progress. And so we really think that this is a great opportunity for the state to think about how we can improve the ways that we do needs assessments among immigrants and other underserved populations. Just a quick note about this legislation, it is going to help serve and evaluate disparities among all underserved populations. It's not only just, it's inclusive of immigrants, but it's also looking at disparities among LGBTQ+, API, and other populations, because we know that immigrants have also intersectional identities and experiences, and so we don't have just single issue lives or single issue experiences, but oftentimes we have multiple identities. So just a flag here for folks, if they're interested in learning more about this mental health work, please take the pledge. Please reach out. We would love to keep you in the loop about how this progress is going and opportunities for people to advocate and support in their communities. Next slide. So I talked a little bit about some legislative work that we're doing, but then there's also this whole other area of work that we call administrative advocacy. So there's legislative advocacy, there's budget advocacy, and there's also administrative advocacy. And so I'm going to talk a little bit about an administrative advocacy opportunity that came out of our research. And one of the things that we found through this research was that counties are a little bit unclear about the extent to which they can serve this population, whether they can serve folks that have more severe needs or less severe needs, and they're just not feeling confident about things and how to serve this population. And so when we see that as a trend across stakeholders, that tells us that there's actually an opportunity for the state to provide support. And so some of the work that we're going to undertake this year is to ask the state to clarify to county behavioral health departments that, yes, they can serve undocumented immigrants with Mental Health Services Act dollars. And so we don't have to pass legislation to make this happen because the Mental Health Services Act has nothing on the books that would prevent them from serving undocumented immigrants. And so what we're saying is we just want you to enforce the law, we want you to reiterate the law, and we want counties to feel confident in being able to support that. And so, State of California, we would like you to issue, say, an information notice to county behavioral health departments that just reiterates and clarifies their rights and responsibilities to serve this population. Next slide. So just want to take a minute here to look at our questions. So folks, just hang on as we look at the questions that have been asked. Great. So one question that we got from one of the advocates on the call is, so are undocumented immigrants eligible to receive behavioral health services through the county without full scope Medi-Cal? That's a great question. So yes, undocumented immigrants are eligible to receive behavioral health services through the county without full scope Medi-Cal. And that is because of the Mental Health Services Act, which is the main funding source second to Medi-Cal. So again, if you are calling your counties and trying to refer clients and they're telling you that they need full scope Medi-Cal, that's something that needs to be floated up to advocates, and you can reach out to CPEHN because that is actually denying people services, and it's something that we want to be able to clarify. So a second question that we got is if we could rename all the counties that we interviewed, and we can do that. Yes, so let me go back to that slide for folks that want to know about opportunities to connect in their counties. So we interviewed Los Angeles, Ventura, Kern, Kings, Fresno, San Francisco, Solano, San Bernardino, San Diego, Napa, and Yolo. So again, if folks are interested in connecting with any partners in that county, in those counties, please reach out to us and we would be happy to connect. Great. So another question that we got is, what are other examples of safe space policies or trainings? That's a really great question because Saili highlighted in her slides that as of August 2018, only 8 out of 12 counties had not implemented safe space policies at their county mental health facilities. And so another example, so Saili gave the example of holding community stakeholder meetings at consulates because people feel safe there. But another really good example that we heard from community-based organizations was that they revisited their sign-in sheets. So previously, they had sign-in sheets that would ask the client for their date of birth or their home address. And so they revisited those intake processes to remove some of those questions so that people didn't feel like they were providing too much personal information. Another really great example of just a practice that is really important for county mental health is to not ask about people's status. And that can be really challenging, right, when we're thinking about data. But we did hear from a couple of folks that we interviewed that they had gone to receive treatment with the county and their therapist had asked them about the data. Had asked them about their status. And so that's a really important practice when we think about making people feel safe and doing trauma-informed work, that we don't want to ask those private questions when people are feeling at risk and unsafe. So the last question here is, what are different ways that folks can mobilize and advocate for cultural competency and the Cultural Competency Plan bill? That's a great question. So we're going to be sending out the slides afterwards along with some of the resources, and you can take the pledge for the Cultural Competency bill if you're interested in learning more about it. And if you take the pledge, it means that you're signing you're just giving your information to this Excel document and going on a listserv where we will actually be providing updates to interested advocates about opportunities to, for example, go to Sacramento and talk about cultural and linguistic competency, or provide input on the language of the bill or how it should be implemented. And then another really important way is get involved with our Behavioral Health Equity Collaborative. So I think in the beginning, Sayuli talked about the Behavioral Health Equity Collaborative, which is a group of local and state mental health advocates that are interested in improving mental health policy. And we convene that group once a month on a call. So we're always looking to engage new members, and we talk about, mental health policy and legislation on those calls. So if folks are interested, again, please don't hesitate to reach out. Last question here is, are there any upcoming Health for All events coming up? Yes, that's a great question. Sayuli, do you know when the hearing, I believe it's on March 20th, do you have details about that March 20th event?
I do not, but it's on March 20th, and we can provide that information when we send out a follow-up email with the recording of the webinar, and I will provide those resources for everyone.
Great, awesome. And so do we want to take the poll one more time, Sayuli?
Yes, one moment.
Great, so just circling back to that poll, can people ineligible for Medi-Cal due to immigration status access county mental health services? So if folks could just answer that poll before hopping off to this call, we'd really appreciate it. And we'll give folks a minute, and then we'll give them back the rest of their time for the day.
Sorry, everyone. It's actually not available at the moment, so I'm going to skip that one. Sorry about that.
No problem. No worries. Great. Well, we'll just give everyone 5 minutes of their day. But thank you all so much for joining this webinar. We'll be sending out the webinar along with resources, including the report, the one-pager. And if you have any interest in getting involved or talking more, please don't hesitate to reach out.